All 193 member states of the United Nations have agreed to work towards universal health coverage as part of their health system's goals. In all of these countries, the private sector plays an incredibly important role in health service provision. This is because almost all of these countries have mixed health systems made up of public and private providers. It follows that the private sector is a very important partner as part of efforts towards universal health coverage. In recognition of this fact, in 2019, Pete Salama, former Executive Director of the UHC and Life Course Cluster at WHO, decided to set up an advisory group to advise WHO and its member states on how to govern the private sector and how to increase the impact of the private sector as part of efforts towards universal health coverage.
The members of the advisory group represented decades of on-the-ground experience in private sector engagement, from research to technical assistance to implementation. The challenge was really how to harness collective learning and expertise to inform WHO's approach to working with the private service delivery sector. Once drafted, we took the strategy through a 6-month consultation process from the WHO regions and external stakeholders to refine the final product. We're looking forward to taking you through the strategy.
To begin, let's start with the definition. Private sector engagement is the meaningful inclusion of private providers for service delivery in mixed health systems, using dialogue, policy, regulations, partnerships, and financing. Effective engagement involves the successful application of 6 governance behaviors.
Well, the first recommended governance behavior is to build an understanding through the generation of intelligence. Therefore, collection and analysis of data allows alignment of priorities for actions.
Build and sustain partnerships by ensuring regular communication that fosters trust.
Empower actors by setting rules and defining what each health actor must do, how they must do it, and for whom. Align policy objectives with organisational structure and culture, and ensure communication channels are established.
To build trust is to understand those factors that promote accountability environments, but also the fears and interests of both the public and private sector stakeholders.
Lastly, formulate strategic policy direction by designing interventions that harness the private sector and articulate roles and responsibilities.
It is because of WHO's commitment to its member states and their efforts towards universal health coverage which has led us to the decision to release this bold strategy, not despite the current context, but because of it.